Good afternoon and welcome to the IUPUI Center for Translating Research into Practice Scholar of the Month conversation. My name is Steve Vieweg. I'm the Associate Director of the Center. It's my pleasure to welcome you to this online event. We're so excited that you've chosen to come and spend some time with us here today. So if you don't know, the Center for Translating Research into Practice is the brainchild of Professor Emeritus Sandra Petronio, who is a professor of communication studies and has a translational scholar herself in the area of privacy management. Dr. Petronio's idea was for IUPUI to identify and celebrate and promote translational research here on the IUPUI campus. I think you know we're a hotbed of research that is community engaged, that generates or uses generated knowledge and solves complex problems in our community. And today is no exception to that. So we're glad that you've chosen to spend some time here with us. I have a few housekeeping announcements to get us going through the day before we introduce Professor Dan Johnson, who's this month's scholar. I hope you've had a chance to view his information on our website to learn more about his work. But what better day could we do this than today, which is Earth Day. So we wish you a happy Earth Day. We hope that you'll be able to take away information from today as we do take care of the place where we live. And I know IUPUI is a great resource for a lot of research that is applicable to help us take good care of the place that we live. So as we begin to work together, you're no stranger to Zoom, but we do ask you that you keep your microphone muted, and so it keeps background noise down. But there is a period where when we get to the discussion that we hope you will unmute and turn on your camera so that we can see each other and have a conversation. That's another one of Dr. Petronio's great ideas, is that we would have a space like this where we could talk to a scholar, get some information, but then have conversation and share ideas so that we could enrich the work and in fact come up with other ideas and connections. We are recording this presentation and conversation today in case you want to share it with others or those that couldn't make it and you'd want them to hear about it. And of course, importantly, we do ask for your feedback afterwards. We're going to send you one of those dreaded post-evaluation events forms. So please take a moment to fill it out. It does help us. And it helps our speakers to know more about the work that they're doing. If you want to know about updates, please check out our website. And you can sign up to get CEUs for these events. In case this is helpful to you, you can go to the link in the chat box and sign up, and you can, over some time, get some continuing education that could go toward whatever credentials that you might have in the work that you do. Please be sure to follow us on all our social media pages. You might have just noticed that the other day, Wednesday, was IU Day, so hashtag Bants Community. We're looking to expand our work and get support for the great work that's happening at IUPUI. So the ways to keep track of us are Twitter and Facebook, of course, but you might also visit YouTube, where we keep videos of a lot of our work, and Instagram. We just like to be available everywhere we are. One of our connections here at IUPUI in the Center for Translating Research into Practice is through our library, and you can learn about our scholars' work by going to their webpage. So you could, for example, check out Dan Johnson, and if you go to the featured page and scroll down to where he is and click on his link, you'll find out more about his work. You'll see a fantastic picture about him, but also importantly, you'll be able to link to his scholarly works through something called ScholarWorks. And the library does a great job of making publications available, easily accessible to you. So you can check it out on our webpage or go directly to the ScholarWorks site. You can find out more about Dan's work or any other of our scholars and find out what they're doing and have easy access in one place to their journal publications. Next month, we have our May Scholar of the Month will be Lindsay Haskett, and her research helps us understand how nurses caring for COVID patients experience secondary trauma and what we might do about that. So please put that on your calendar. May 27th, we're generally near the end of the month on a Friday, always at noon. And we always finish early enough for you to be at your 1 o'clock appointment. So we don't want to waste any more time. It's my pleasure now to welcome to the stage Professor Dan Johnson, who is a professor of associate professor of geography in the School of Liberal Arts. And today He's going to talk to us about interactions between social and environmental vulnerability. And so we're looking forward to his presentation. I will stop sharing and let him share his screen and come on board and give us a setup for this conversation. So welcome, Dan.
Thank you, Stephen. I appreciate that. I especially appreciate being invited to talk on Earth Day with, especially with the environmental vulnerability piece that my work involves. So as you see here, this looks like maybe a map table we might have used to have in our lab downstairs and in Kavanaugh Hall, where we had maps laid out all over the place and all that sort of thing. So I'm going to be throwing a lot of different images and maps at you, hopefully to help generate some conversation on this topic, because it is so it's a very important discussion in today's environment. So it's also, as we frame this, is to discuss what actually is vulnerability and how does that fit in. So this is a model developed by a researcher back in late 90s, so around 98, 99, building a triangular look at risk to natural hazards, where each side of that triangle, one side was represented by vulnerability, one side by exposure, one side by hazard, and risk is sort of in the middle of that. So these three things are necessary to, understanding all of the three of these things are necessary in order to understand the risk to a certain hazard. But the vulnerability piece that I specifically work in, and we could break vulnerability down, it's a very broad, incredibly broad topic, but I break it down into a social vulnerability component and then an environmental vulnerability component. And so what is social vulnerability, right? It's a community's inability sort of to respond to an external hazard or, something of that nature that, there's something about the community that just, has an inability to, doesn't have the resources to respond to it. This is the CDC's definition. So, and we could find numerous other definitions, but importantly, a lot of people jump to this conclusion, and I hope the discussion today sort of gets into resiliency more. A lot of assumptions are that social vulnerability is the inverse of resiliency, or socially vulnerable communities lack resilience. And sometimes that's not necessarily the case, as we can talk about later. Environmental vulnerability, this is, we could probably interact this with hazard a little bit. That's a piece of it, but it's kind of where that overlay between the hazard and vulnerability lie. This is where the environment has a tendency to produce a harmful impact on human health. So flood zone, right? Those have a tendency to produce hazardous environments, but not all floodplains or flood zones are created equal, right? There's different variations within that flood zone for different levels of a flood, right? The important thing is both social vulnerability and environmental vulnerability are both spatially and often they're temporally variable. So we can map these, right? We can map this out through time and space and see how social vulnerability is changing over time and how the environmental vulnerabilities are changing over time. But when these two come together, right, when we have a community that is both socially vulnerable and environmentally vulnerable to a particular event, so say in this context, we introduce high temperatures, extreme temperatures, to a community that is both socially vulnerable and environmentally vulnerable to this hazard, we end up with an extreme heat event and an extreme disaster. This is a map. This is a study I did long ago of Chicago's 1995 heat wave. And this is sort of the heat wave that brought extreme heat into the public consciousness. You know, people were dying right and left in Chicago during early July of 95. And there really wasn't a good understanding of why that was happening. You know, it was, we ended up geocoding about 700 deaths that occurred in homes. So that's sort of I can't remember the exact number that we ended up geocoding, but it was more than the official number that was released, well over 700. And you see some of those points spread out here. A lot of those coincided with higher temperatures associated with surface temperatures of the urban heat island effect in cities. So how do we measure social vulnerability right now? So say I'm working at a health department in Indianapolis, and manager comes in, or my boss comes in and says, Dan, I want you to map out the socially vulnerable communities in Indianapolis. I want to know what communities are socially vulnerable. Do it by census tract. Okay. So I find the social vulnerability index that was built in the early 2000s, around 2003. Then I find the CDC social vulnerability index that was built around 2011, at least the modeling, the idea behind it was 2011. Both of these data are from the American Community Surveys from 2015 to 2018. And throwing on top of that, we have the Thrive Index, which stands for Tools for Health and Resilience in Vulnerable Environments. So how do I determine, using all of these different social vulnerability indices, how do I determine which one, which one's the correct one? So that's where some of my research lies. So we look at different different measures of vulnerability, social vulnerability. So we see here the CDC Social Vulnerability Index. We see the Cutter's Social Vulnerability Index, right? And you see the differences in the two, right? You can clearly see, the CDC Social Vulnerability Index really highlights this area in the Deep South. You see a lot of urban areas highlighted. With this one, not as many areas. You still see some clustering in the Deep South. You see the urban areas overlaid with this. The reason for the differences is just the different data that are used in them and the different modeling approach that is used to come up with the index. So if we take these two and do a combination of them, this is just an additive approach to combining them. We can do it in much more sophisticated ways, but we sort of see where areas are tending to be higher in both categories, really focusing, again, we see this area in the Deep South that is highly vulnerable, urban areas across the country, areas out west. And here's another look at it. So this is another look, just sort of seeing where we have high levels. So if you look at the purple here, that's where we have high measures of the CDC Social Vulnerability Index and high measures from the Cutter's Social Vulnerability Index. Again, we see these areas in the Deep South and our urban areas across the country. So, it's difficult for, I've had health departments ask me, which one do we use? Which is the most appropriate? And you'll have health departments build their own, which adds to some of the confusion as well. So we sort of try to look at it in a composite sort of approach, using all of the available data that are used in both indexes, or used in all of the indexes we look at, and see the spatial and then the temporal variability. I'm not showing you many maps today on the temporal change, but one area that I am starting to really focus much of my current work in is looking at how social vulnerability and measures of segregation overlap. So, and I'd be happy to talk about this at another time, or with any of you that are interested. You see here, this is an older 1960s way of measuring segregation, but it's pretty well established in the literature, called the Duncan Segregation Index. Some of you might be familiar with that. And we have our CDC Social Vulnerability Composite. These darker purple areas are where we have high levels of segregation, high degrees of social vulnerability. I'm doing this now. I have a paper I'm getting ready to put out that looks at the top 200 cities across the country. And it's looking at how social vulnerability and segregation are related. But more importantly, it's also looking at the temperature differences from different racial minority groups within the country. And we're seeing that our non-white populations in many cases are living in communities that are 7 to 12 degrees Celsius hotter than the surrounding temperatures of that city. So I'm kind of getting off track there, but that's a study I'm getting ready to put out. But getting into environmental vulnerability now, here's a look at land surface temperatures in Indiana. This is a composite from 2017, and you can clearly see the urban heat island effects across the entire, the entire state, right? And clearly see Indianapolis and the development in Fishers, Hamilton County up there, Anderson, Muncie, down here in New Albany, Evansville. These are all pocketed across the state, highly visible in thermal imagery. Here's a look at just surface urban heat islands from cities, and the red areas, of course, are showing hotter location than the green areas. And we'll look at Indianapolis here. And these are the red areas are 7 to 10 degrees hotter, and this is in Celsius, than the surrounding countryside. And then it sort of breaks down from there. So if we look at how urban heat, a extreme heat event might affect Indianapolis, we can look at how the surface urban heat island effect adds to that. And in fact, there was a study done years ago of what's the most likely natural disaster to strike Indianapolis. A lot of people think big tornado, right? We're going to have a large EF5 tornado rip through the city, or the earthquake, right? The New Madrid earthquake. Most likely is an extreme heat event that will, settle in the city for several days, causing not just heightened deaths, but taxing of the the emergency management and healthcare system. And that was a big concern during the first summer of the pandemic, where we thought we would have, in some cases, cities did experience both people coming in for COVID-19 and people coming in with extreme heat. So both were a big problem. Again, land surface temperatures around Indianapolis. This is a 2016 look at it, all right, just kind of showing how temperature differences are, the different, what we call sort of a micro urban heat islands around the city. Sorry, I skipped one there. And then just looking at through time. So this is one I'm showing you. This is one of the ones I'm showing you through time here. We've got a model that I developed, the Extreme Heat Vulnerability Index, that looks, we've got Indianapolis from 1990, we've got Indianapolis in 2000, and we've got Indianapolis from 2010. You can kind of see how, it's changing through time, right? These temperatures due to development are changing, but also populations are moving. So interestingly, it became more clustered in 2000 and then became a little more dispersed again in 2010. And hopefully in the next few months, we'll have enough data released from the Census Bureau that we'll be able to create the 2020 version of this. So, looking at it from an emergency management standpoint, there's a possibility of what we refer to academically as a convolutional environmental vulnerability, where we can have multiple environmental stressors impacting a community at the same time. And so what I'm showing here is, and this is a little surprising for some people, is the riverine flooding risk, but also earthquake risk. And what sort of pops out to a lot of people is, yeah, this, Indianapolis or, Marion County is in the zone of what we call highest risk, at least comparing across the country, to both riverine flooding and earthquakes due to the New Madrid fault line. So looking at riverine flooding risk and the CDC social vulnerability index, and I've highlighted these red areas to show these are the areas of highest risk, due to extreme flooding from rivers and this the social vulnerability included in it. Right, so we see obviously a lot of places along the Mississippi, which you expect those of seeing those earlier maps of heightened social vulnerability in the Deep South. But Marion County pops out of this, right? Marion County's in it, Madison County with Anderson. So a study right now that I have, it's in minor revisions, was looking at building a what we call a dynamic Bayesian network. And I'm going to try not to get too technical with this, so I apologize if I get too technical. But this is an artificial intelligence approach to predicting COVID-19 relative risk or community level relative risk with this computational method. So on the left, we have what we'd call a simple Bayesian network. And with this, we have, I'm just showing it in the context of an extreme heat. We have temperature, we have heat-related illness, and we have humidity, right? Temperature can cause heat-related illness. Heightened temperatures can also increase the ability of the atmosphere to hold more water moisture. So we build with these connections you see, we build conditional probability tables that based on different data that are present in these circles you see. The circles represent different data sources. So we could say with this, if the temperature in this location reaches 95 degrees and the humidity is 90%, what's our risk for heat-related illnesses across space? And that's what is limiting with this simple approach, is it's just giving us sort of a cross-sectional view, a snapshot in time. But we can make this a dynamic network, and that's what my approach with this is we take different time slices and we build this recurrent structure of these different simple networks, but they link to one another. So we have the relationships I just described in one time slice, but then those relationships impact the next one to a degree, that impacts the next one, and even relationships at time slice here can affect things at this time slice. So we have, in the case of our network, we have literally probably hundreds of different conditional probability tables outlined. Here's the structural overview of working to predict the COVID relative risk. So included in this, we have some temperature data that's from NASA. It's a NASA model that that helps utilizes surface observations as well as remote sensing observations. But included in it also is level of precipitation, and we bring in the CDC Social Vulnerability Index, the social vulnerability, the Cutter's social vulnerability. This is the FEMA National Risk Index, which I've shown you a little bit of. And then another piece to it is resiliency. So this is this is referred to as the baseline resilience indicators for communities. All of those are sort of fed into this. You see one increment here, but all of these are fed in to build predictions through time. They're looking at what actually occurred in May 2021, what actually occurred in June 2021, July 2021, August 21 to predict what took place, what will happen here. All right. And this is kind of just an increment showing how different things feed into what we're most interested in, which is this central relative risk. Here's some outputs from this model. And we have to, with most of these Bayesian network approaches, we have to build categorical variables. So we have to make our continuous variable of relative risk discrete. So we break that down into a high risk, low high, high medium, low medium, high low, and low low. And on the left, so this, I probably should have switched these around. I have October 2021. This is what was predicted based on all the data and the network that came in. This is what actually occurred on the right. And we see differences right here. Importantly, the differences are not spatial. I have some students, I think, and I know I have some students in here, and they'll understand what I'm talking about when I say these are not spatially clustered, right? The residuals from this are not spatially clustered. They're random in space. We look at March 2021. We also made a fairly good prediction of, the predictions are approaching in the lower 90% of areas to be most likely impacted based on all the previous variables. So we are working toward using this model to, look at COVID in the future, but also bringing this into other extreme heat. So other, other health issues and diseases is what, hopefully we'll be working with this model. So one area I wanted to really kind of push our discussion today is in this topic of resiliency, because that's what's really coming about now. And I have a colleague, she works in the New York City Health Department, and she shared some quotes with me that people have said to her as they go into different communities and work to improve health there. And one of them, I have here that, I'm so sick and tired of hearing that our community is socially vulnerable. What are you going to do about it? They don't want to hear that, these residents don't really want to hear that that their neighborhood is vulnerable. They already know that, or they're tired of that negative connotation with vulnerability. So as I build these social, these vulnerability models to different diseases or events, the residents, and actually to make these models more useful, I don't want this type of work just to sit on it doesn't sit on a dusty shelf anymore. I guess it's in a computer somewhere. But you know what I'm saying? I want it to have some impact. And this resiliency issue, right? Or not issue, but this approach to it from a resiliency standpoint is kind of new to me. I've not really built what I call a resiliency index yet, because it's kind of difficult for me to feel like I can quantify resiliency, the way that we can vulnerability. So, that's kind of all the slides I have, and I hope that's a little bit of food for some discussion here today. And I'd be happy to back up and do any, show any slides that that you'd want to see again. Let me get my camera on now.
Well, thank you, Dan, for setting the stage for what I hope is an interesting conversation. And I'll invite our colleagues, our audience here, to turn on your cameras so we could see who's here, and invite you to raise your hand or to unmute to ask a question or to pose a comment, etc. And you heard the invitation from Dan. If there's a particular slide that you'd like to go back to for discussion,
I'd be happy to do that
as well.
Be happy to do that. Yeah, would be happy to do that.
So we'll pause for a moment and see if there's anyone in our community that would like to begin the discussion.
If I can chime in, this is Greg Mobley in the archives over at the library.
Yeah. Hi, Greg.
Dan, how much, in looking at these various communities, how much of it is based on economics?
Well, yeah, quite a bit of it is. If we look at the, let me back up to a couple slides here. If we look at the CDC vulnerability index for Indianapolis here, literally, I mean literally 1/4 of that, economics accounts for 1/4 of that. There's a separate component that is fed into that is considered the economic or socioeconomic capacity of the community. So a lot of it is economic, Greg. And interestingly enough, you bring that up, some of the economic pieces of it too also can add to the resiliency of that community, right? So, it's a large piece to it. We found some interesting relationships between, in a recent study we did for COVID-19 across the US, we found some interesting relationships between people that were unemployed and employed. How the unemployed seemed to be getting COVID less than employed, but it was only the case for certain communities within certain economic patterns. So, that's a really important piece to it.
I have a question for you, Daniel.
Yeah.
This is Gerardo Maupome from Fairbanks School of Public Health.
Hi.
I find this fascinating. Very nice presentation.
Thank
and
you.
Let me tell you that in a former life, I should have been a cartographer because I love maps. No, seriously, I love maps. It's one of, wow, look at this.
Yeah.
And to me,
Yeah.
GPS has been kind of a setback because I always enjoy looking at maps and
That's true.
tracing how I'm going. Anyway.
That's true.
Now,
yeah.
On a more practical level, and this is something where perhaps you have already stated that I lost, perhaps I missed it.
Yep.
If you have a vulnerable community because of social characteristics, and if you have a place that is environmentally vulnerable because of higher temperatures and that kind of thing.
Mm.
Now, I think that the real crux here is, where is the causality going? Is there have you been able to find a causal relationship, or this is associated only? I will imagine that if you have a place that is primarily made of concrete and there are no green spaces, that area should be hotter. That would be my guess. But is there really kind of a causality, and in which direction it will go? Poor people go to a place that is not all that great to live because that's the only place they can afford? Well, how does that work?
Yeah, no, that's a really deep and very good question. And it's interesting because our Bayesian networks, are developed by researchers interested in causality, and so. And there's some researchers that would tell you, well, if it shows in our Bayesian network that higher temperatures, the higher temperatures are the cause, or is it because, if our Bayesian network's showing that, then that's the cause, right? That's causing it. But it's capable as well of tweaking out some of that other pieces, like you mentioned. The poverty is originally what caused the community, the people to move to that community that was already at risk. It's possible to tweak those kind of things out, and my thought on it would be, and obviously those are going to be variable. The patterns of that and the weights of cause or weights of impact from each variable is going to be different for every community we might look at. But yeah, I think we can kind of tweak some of that out with our approach we're using, and that's one of the strengths of it. I feel that it can find some of that deeper deeper pieces that cause the place to be vulnerable in the first place. Yeah. Does that help? Does that answer a little bit?
Yes.
Yeah. Thank you.
Well, I appreciate the questions that are coming up, because it's reflective of what we hope happens in these conversations is to think about how is this generated knowledge useful in solving the problems. So you've identified some problems. I love that the slide that you stated that says, oh, the confusion, because I think there's so much there, but to help us understand how this applies. So I love that kind of question. What other questions are coming up? Reminder, invitation, please turn on your cameras so that we can see you. out in the audience as we're engaging in this conversation. Other thoughts that you have?
I agree with the professor from Fairbanks. I think your work is incredible and amazing. And I think the maps, they invite a lot of questions. My name is Sahan Ranama. I'm an assistant professor of dermatology and internal medicine at the School of Medicine. And my question is also similar. I think these maps, they're so rich in the visual data that they, bring up other possible associations. And when I look at these maps, I think not only of social vulnerability. When I looked up the score during your talk, it seemed like it was based on socioeconomic status and age and language, and those were very interesting. But these could also be, as you said, heat maps for the environment. They could also be food deserts. They could also be areas where there isn't much medical access or air pollution. And that's why I think these maps are so interesting. So I have two questions for you. How do you tease at those relationships? Is that through this iterative process where you say you may tweak some of these models and maybe measure and see which one of these are? Is that like a map-based process? Or is that by looking at a statistical process where you can look at the different variables and their weights, or the different scores and their weights? Like, I was just kind of curious, like,
Sure.
different things go into it. What's your process for that?
Yeah, well, it can be both. So we can see both the weights visually and sort of tabularly in statistical form. And it sort of depends on how deep our network is. If it's containing a year's worth of data broken down by month, we can tweak out potential relationships back several months. And how I would do that was I would first look at that in a tabular form, sort of like a spreadsheet that would give me those weights, which in itself sort of these conditional probability tables. And from, even from that, what's also really interesting about this, I can do all sorts of what if analysis. So I could say, in July of, let's change that. Let's say in April of 2022, and I want to model extreme heat event in July of 2022. Let's say we have one in July of 2022. I can look back through the data and see if there's, something in there that might have caused, if the data is rich enough, that what would cause, at least some of that, might have been a factor in that extreme heat event and what neighborhood was affected. The emerald ash borer, for instance, right? I mean, when the emerald ash borer came through, destroying tons of forest cover, right, within the city, it made a lot of neighborhoods hotter. So because the tree canopy coverage was gone, that's a variable we could tweak out of that, because we look at the forest canopy coverage, because that's also a variable in the environmental vulnerabilities. But yeah, it's a fun process. It's a lot of fun to do, at least for me. I spend a lot of time sitting in front of a computer. You have to, like I tell my students, I said, you have to love to want to sit in front of a computer all day to do this stuff, right? If you can't sit in front of a computer all day, you might want to find a different line of work, right? But that's a great question. I appreciate that one. Yeah.
I have a computer all day, so I don't know if that will. So
yeah,
that's really great. I have also another question, because I don't study COVID, but I find your measures very interesting to explore structural reasons for health.
Mm-hmm.
Practically, are you kind of limited by diseases that there's good temporal data on, that you can maybe look at when correlate these changes in, say, the climate patterns with incidence of disease? Like, what kind of limits these analyses?
Yeah, good question. And that's one of the great, I hate to say great things about COVID, because when the pandemic, following beginnings of the pandemic, seeing how that was occurring, and late November, even there was mention of it, I think late November of 2019, that this possibility of a pandemic. And once it started, as a geospatial data scientist, I'm like, it's a terrible thing, but it's a great thing to study because we're going to have plenty of data for it, right? People are collecting data for it. At least we're collecting a lot of data for it every day. Addresses of cases. I was able to pull from the Indiana Network for Patient Care, the COVID cases by census tract. And those were tabulated daily, but then I aggregated them monthly. So we are limited somewhat in that. I look at COVID. That's why one of the reasons I'm using these two different disease processes, I guess, the COVID-19 and extreme heat, because they're both at the end of they're at the end of a spectrum, each at separate ends. With COVID-19, we have all this rich data, right? It was all collected. We've got amazing amounts of that, down to the extreme heat where we don't have so much of that, right? I mean, that's a really hard one to kind of nail down until there's a death from it. And even then it's like, was it extreme heat? Was it caused by something else? Was it the harvesting effect? So yeah, I mean, we are very limited, I believe, in the temporal quality, the longitudinal quality of the data. And it's one reason I want to try to explore more of what's in the Regenstrief, the Regenstrief electronic medical record system, because when I came to IUPUI, that was kind of one of the pitches for IUPUI to me is, hey, we've got this great data. We got this electronic medical record system at the Regenstrief, and you can mine it and do all this great stuff with it. And it's like, hey, that's great. This sounds great. It's exactly what I want to do. But come to find out, it didn't seem to quite be the gold mine that was promised, but there is rich data there. I don't want to take anything away from that, but it's more complicated, I feel, to get into some of the data other than COVID-19 has been pretty easy to get a hold of. And so, yeah, we are, I feel, very limited from that.
I see that Amber has her hand raised, so let's let her ask a question or comment.
Yeah.
Go ahead,
Yeah.
Amber.
Thank you. I'm Amber Osterholt. I'm an assistant scientist at the Indiana Clinical Translational Sciences Institute.
Hi.
And I have, I think, 2 questions for you.
Okay, sure.
The first being, is there kind of a threshold for like ambient temperature versus extreme heat at which this kind of tends to peter off? I'm thinking places like Las Vegas, where the summer heat average is in excess of like 105, 110 degrees, where an extreme heat event may not even exist, really.
Yeah. So that's a great question. It's difficult to answer, and there is a threshold, and because we adapt, right? Or we physically sort of adapt to temperatures. So obviously the threshold in Phoenix, Arizona for extreme heat is going to be different than the one in Indianapolis, obviously. Something that we would consider a heat wave here, if we put that in Las Vegas or Phoenix, they're going to say, well, it's hot, it's a little muggy, right? But they're not going to feel the heat they typically do. One thing we get they say, well, it's a dry heat, right? Well, that's true. That's true. It's a dry heat. We get more humid type heat events, obviously. And that threshold that you mentioned is difficult to nail down because it can change from year to year what that is. There's different ways to measure it, looking at, say, the past 5 years of temperatures and saying, well, if we're 2 or 2.5, 3 standard deviations above our typical high summer high temperature, that's a heat event. And usually for it to be declared an extreme heat event, it has to happen for several days. But then if a heat wave comes through next time and it's same temperature, it's likely that we won't have as many complications because of just people adapting to it. But one thing that's interesting about this that I like to bring up is the temperature for declaring an extreme heat event is measured at the airport in a white box 1.5 meters above the ground. Right. So that's the official temperature for Indianapolis is out there. And so that's the one. But we can have a temperature out there, say, of 90. But in some of these areas in the city, we can have, there it could be 110 already, right? So there's areas of the city where we could call an extreme heat event on a day where it wouldn't be affecting anyone in the suburb, but areas in the city, because of the heat, urban heat island, could be an extreme, very extreme temperature. And that's something I think health departments are just, to me, it feels like health departments are just starting to understand that. Cities are just starting to understand that. And I think you had a second question too.
Yeah, great. Thank you.
I hope that
Thank you.
answered it.
One, thank you for that answer. My second question is maybe kind of a little bit more less related, but thinking about social vulnerability and looking up like the definition and things like that. Violence doesn't tend to be included in social vulnerability, and I'm wondering if there's a way of accounting for that in your modeling.
Did you say violence?
Yes.
Like crime? Yeah. So
not necessarily just crime, but like other types of violence as well, as far as more along the structural side of things.
could you describe that a little bit? Like violence of structure? I don't.
Sure. So structural violence, at least as far as the traditional definition, would be things that are really kind of built within like our social networks.
Okay.
Or our society that are really designed to keep people poor, sick, and under control.
Yeah. So there's two sides to that. There is no, I have not yet to see a social vulnerability index include either of those. And I've wondered for a while why, and it's something I wanted to look at, and hopefully I can get one of my students someday to do so, is looking at crime in particular, and we could even pull out violent crime from that and how that relates to areas of social vulnerability. And would it help, would it improve the models to include that as a variable? I think a lot of this, and that kind of feeds into my research a bit on the segregation, and how it's related. And there is no measure of segregation included either in any of these vulnerability indices. In fact, there doesn't seem to be as strong of a relationship between it as you might expect, which leads me to wonder if that needs to be included, some sort of measure of segregation that would that would show some of the some of the systematically racist policies that have caused that. And you can look at like we could pull up some maps, and I probably should have done this, the historic redlining in Indianapolis and how a lot of these vulnerable communities are still, they're still in that area, right? They're still in those locations across the country. And there's a few studies out on that right now of how not so much how social vulnerability is within those redlined areas, but just how the economic thing, the socioeconomic, the poverty, how that's so well embedded in those historic areas. So I've yet to see an index include those. I think it would. If that's what you're thinking, I think it would improve the models to some degree, because obviously they're not perfect. We'll see we pull up social vulnerability and some disease, and you think, oh, it's going to be so well related to that, and it ends up not really being the case, or it's at least not as straightforward as we think. Yeah, so that's a great question, Amber. I hope I answered that.
You did. Thank you so
Yeah.
much.
Yeah, thank you.
Well, I want to thank our community for asking really good questions. And I would propose,
Yeah.
Dan, that you change this slide here instead of saying, oh, the confusion, to
Oh,
say,
sure.
oh, the opportunity.
Well,
Because
yeah,
I'm
right.
hearing all kinds of ideas and questions about how do we use these? How do we, across the different disciplines and areas of work, how could we build on this idea that you have? I hope that's one thing you're taking away, and I hope the rest of us are thinking
Yes, for
about
sure.
how do we contact Dan and explore this even further. That's one of the beauties of these kinds of conversations, is finding out where the connections are and the opportunities. And so I think my sense of the conversation today is that this is incredible work and has some great opportunity for helping us to better understand some of the complex challenges that we face as a community and how we could work together to fix them. So thank you for doing
thank
that
you.
today.
And I think it's a good topic for Earth Day too, right? I mean, it's all
Exactly.
human impact on the environment, environmental impact on humanity. So, right.
So we have a lot to think about today on Earth Day. And as we wrap up today, we do want to remind everybody to respond to the opportunity to give us some feedback about this event, to share this with your colleagues and friends, and to remember that there is a recording of this, and you'll be able to share this with others. We are on Facebook Live, so it's another way that we try to reach everybody. So do follow us on various social media networks, and be sure to come next month in May as we continue this opportunity to have these monthly conversations. So we'll formally end this opportunity now, because we know that people need a chance to get themselves refreshed before they go to their next appointments at 1 o'clock or wherever you are at the hour. But we'll stay on for a few moments for that traditional, after the presentation, if somebody wants to say something to Dan or ask another question, we'll be here for the next few minutes to be able to do that. So we'll say goodbye to our Facebook Live audience. Well, thank you all for joining us today. And thank you, Dan, for giving us a lot to think about on Earth Day.